Mo Senator bwe county ya Nyamira Moske Eric Okongo Mogeni negaikiria monchirorio ase bunge ya senate ayorengete gukora monchirorio ase umuswada o health gose umaikana health amendment bill asanyara kaba gakuboria umuswada yonya kaba kurigereri gubya elio amonchirorio yonya kaba kubekera ni gororo ayorengete gukwegerera ya amate gose chi amate chiriji konyara gwanse namono ase okurigyo weni ase nyagitari korengana no Mogeni nigo egati ye chi amate chigo tangwa nyagitari chinga kibasinyira gwakana enibo yaye egenda nyaka wakone kibuna nigo kirachiko mamije lichiko wetera asomo swada oyuo omoya.
The amendment, Mr. Speaker, proposes to amend the Health Act 2025, Mr. Speaker, by inserting a new section 7A to address a number of issues affecting those who are not able to pay medical bills that are incurred in our public hospitals and in some cases in our private hospitals. Mr. Speaker, I am sure that all of us senators from our respective counties, we have had instances, Mr. Speaker, where those we refer to as hustlers, those who are not well endowed financially, get attended to in hospitals, they incur medical bills, Mr. Speaker, but because they don't have the economic means, Mr. Speaker, they end up not paying their medical bills, either in public hospitals, Mr. Speaker, or in private hospitals. And Mr. Speaker, what has been happening, which is very unfortunate, Mr. Speaker, is that hospitals have resorted to recovering their debts by either detaining patients, in some instances, detaining mothers and their young children in hospital as a way of holding them in lien till their debt is paid. So, Mr. Speaker, the proposal on the table through this amendment is to outlaw any detention of a patient or a corpse due to an outstanding fee incurred in relation to any treatment offered in a health facility. And Mr. Speaker, to make that proposed amendment effective, Section 7A, subsection 2, Mr. Speaker, proposes that anybody who is in charge of a health facility who contravenes that section that outlaws detention commits an offense. And thirdly, Mr. Speaker, so that we have a buy-in from the government, Mr. Speaker, I've proposed in clause 3 that the Cabinet Secretary responsible for health issues will make regulations on the enforcement of this proposed amendment.